الشابتر الأول ضمن الكورس مالتنا اللي هو Organic Pharmaceutical Chemistry هو Drug Design Strategies. Traditionally, the process of drug design and development is based upon screening approach and trial and error method. And here this process requires structural modifications to an existing compound, whether natural product or certain drug, known to have certain pharmacological activity, and therefore you do structural modification, you synthesize different number of compounds and then test their biological activities in vitro or in vivo, before you find active compounds that can go through clinical trial. So this process requires time and it is costly, so it's time consuming and costly. You have to synthesize thousands of compounds, and at the end you may come only with a few compounds that are found to be pharmacologically active. However, modern drug design is based now on the computer-aided drug design, where by the use of computer and the availability of number of software, this approach is now utilized by almost all the pharmaceutical companies and drug factories. So instead of synthesizing thousands of compounds, you can design a few number of compounds by the computer software, and by this you can decrease the time and cost. So the few compounds that are designed by computers then will be tested and found to be active by the computer programs. Then these compounds could be synthesized and then tested for their biological activity. And so the computer-aided drug design is, you can, by the computer-aided drug design, you can design molecules that can show good fit to the receptor. This diagram is a summary of drug distribution. So following introduction of a drug into the body, whether orally or parenterally, the drug will reach the systemic circulation. And here in the systemic circulation, it should survive many sites of attachment, like for example proteins like serum albumin, or the storage sites, tissue depots, and also should avoid significant metabolic destruction in the liver before it reaches the site of action, which is usually the receptor. At the receptor, drug will bind to the receptor, and the following equation اللي هي موجودة up, drug with the receptor interact with the receptor will give drug receptor complex, and this will give the pharmacological response. The equation interaction of drug with the receptor usually is a reversible process. بتشوفك سهل يعني يروح يرجع حتى يكون لي complex. يعني drug can bind to the receptor to give the complex, at the same time the drug can dissociate from the receptor, releasing the free drug. However, you have certain exceptions including alkylating agents, for example, used for cancer chemotherapy, or choline esterase inhibitors, irreversible choline esterase inhibitors. These examples, the drug can bind to the receptor in an irreversible manner. That means the drug will bind to the receptor and form by covalent bonds that the drug cannot be dissociated from the receptor. Following oral administration, the drug must go into solution in order to pass through GI mucosa. And here we have several factors govern the drug dissolution, like the chemical structure, particle size, nature of crystal form, and the type of tablet coating. All these factors affecting the drug dissolution and then will change the ultimately will change the bioavailability. Sometimes we do chemical modification on certain drug in order to have some benefits. فهنا أنا عندي المصطلح Prodrug. What do we mean by Prodrug? Prodrug is pharmacologically inactive compound which is converted inside the body to the active drug by metabolic biotransformation, and this biotransformation can be either enzymatic or non-enzymatic. فالبرودراج ممكن أن نستفاد من عنده several benefits. ممكن نستفاد من البرودراج to enhance absorption. ممكن نستفاد من عنده increase water solubility. ممكن to target certain specific tissue, يعني to facilitate drug reaching certain target. أو sometimes ممكن نستفاد من عنده إنه to get rid of or to mask unpleasant taste. فهنا أنا عندي some examples of prodrugs. The first one is the oxalazine. Oxalazine used for treatment of ulcerative colitis. This is a prodrug of the pharmacologically active drug اللي هو الميثالامين. ميثالامين إذا تشوف الستركتشر هو عبارة عن 5 amino salicylic acid. Methylamine اللي هو pharmacologically active compound, it is not effective orally because it is metabolized to inactive form before reaching the colon. فحولوا الميثالامين إلى prodrug اللي هو سووه dimer of methylamine by azo linkage. صار عندي الأوسالازين. أوسالازين هو يعتبر كبرودرug, and this dimeric form can pass through significant portion of the intestinal tract before being cleaved. يوصل للcolon before being cleaved إلى 2 equivalents of methylamine by intestinal bacterial enzymes. فهنا الأوسالازين هو prodrug اللي هو استفادنا من عنده to facilitate drug reaching the specific target. Another example عندي الكلورامفينيكول. كلورامفينيكول اللي هو الستركتشر، طبعا هاي الستركتشرز مطلوبة مال البرودراكس، هي يعني دراكس ويا البرودراكس مالتها. الكلورامفينيكول عبارة عن compound اللي عنده bitter taste. إذا تبعوا الستركتشر الار جروب هي عبارة عن H فهو الكحول، فالالكحول عنده water solubility. فهذه الووتر solubility تخلي هذا الكومباوند water soluble enough to come in contact with the taste receptors on the tongue فتنطيني البيتر taste. فحولوا الكلورامفينيكول إلى صيغة prodrug to mask this bitter taste. حولوه إلى prodrug by esterification with palmitic acid. فصار عندي الكلورامفينيكول palmitate اللي هو OCO-CH2 by 14 CH3. صار عندي كلورامفينيكول palmitate. هذا الكلورامفينيكول palmitate بهالحالة هذا من حولناه إلى ester of palmitic acid will decrease the water solubility, and therefore this can be given as oral suspension that can pass over the taste receptors on the tongue without giving the bitter taste. فهنا نستفاد يعني من عند to mask bitter taste. Another example عندي enalapril. Enalapril هو used for treatment of hypertension. pharmacologically active compounds بالأصل هو enalaprilic acid. اللي تشوف الستركتشر مالته R group is H يعني COOH. هذا راح يكون عنده high solubility. فبهالحالة هذا cannot pass through the membranes. فحولوه إلى ethyl ester COO ethyl يعني تحول إلى Prodrug اللي هو enalapril. والenalapril بهالحالة هذا قللنا الwater solubility، زيدنا الليبيد solubility، فتحول عندي إلى more lipid soluble، وبهالحالة هذا كان pass readily through membrane. ويعني بهالحالة استفادنا من enalapril is used to enhance absorption of the drug. هذه الاستراكشرات مطلوبة الدراكس ويا البرودراكس مالتها. Following oral administration, drug can act locally in the GIT, or the drug can pass through the mucosal cell and reach the blood or the circulation. The passage of the drug into the mucosal cell can be either passive or active process. And the lipid membrane is a very complex structure where it contains some channels. Sometimes the drug will pass through or will move into the cell through the process of pinocytosis, or sometimes the drug can resemble normal metabolic precursor that can actively be transported into the cell. Parental administration can be used in several cases. For example, when the drug cannot be tolerated by patient when given orally, or sometimes when the drug can be distracted or become rapidly inactivated and completely metabolized when after absorption through the process of first pass effect, where the drug is metabolized in the liver. The types of parenteral administration are different with different distribution rate. For example, IV injection, the drug will be administered directly, or you put the drug directly into the blood circulation. This gives rapid distribution. However, the subcutaneous or intramuscular routes will give slow distribution. We have other routes which are intraspinal or intracerebral, where you put the drug directly, you introduce drug into a special organ. Where intraspinal, you introduce the drug directly by injection into the spinal fluids, or intracerebral into the brain. The prodrug design can also alter several other properties. For example, prodrug design can alter solubility characteristic, and this will give or increase flexibility in formulating dosage forms. The example of prodrug design that can alter solubility is methylprednisolone. أيضا هاي الستركتشرز مطلوبة. الميثylprednisolone has or considered to be slightly water insoluble. methylprednisolone, R group is H, يعني CH2OH. So it's slightly water insoluble. If you convert it to acetate, you will have methylprednisolone acetate. R group راح تكون CH3. فلما نتحولها للأسيتيت will form highly water insoluble compound, and you can formulate it also as sodium succinate, يعني methylprednisolone sodium succinate, which is R group راح تكون CO CH2 CH2 COO, sodium salt, sodium succinate. Methylprednisolone sodium succinate will be highly water soluble. راح يكون water soluble. So you can make advantage of changing solubility in flexibility of dosage form to be used in different uses. For example, methylprednisolone as itself can be used orally in tablet form. methylprednisolone acetate اللي هو highly insoluble can be used in ointment, topical ointment, and also sterile IM suspension for IM injection, while the methylprednisolone sodium succinate, which is water soluble, can be used for IV, IM dosage forms as well as oral dosage form. The Prodrug approach or design can also change the biological half-life of the drug. أيضا هنا الستركتشرز مطلوبة. عندي الإكزامبل هنا هو الاتريتينيت and acitretin. هذول both drugs هما used for treatment of psoriasis. Pharmacologically active drug اللي هو الacitretin have terminal half-life which is only 33 to 96 hours, and therefore it can be converted to a prodrug اللي هو ethyl ester اللي هو الاتريتينيت. By converting the acitretin إلى البرودرug atretinate سوينا methyl ester صار عندي prodrug. هذه بهالحالة احنا we change the biological half-life. The biological half-life or terminal half-life for atretinate is 120 days. So it has long duration of action. So this drug has longer duration of action, can be stored and released in adipose tissue لأنه it is more lipophilic, and therefore their effects can continue after the dosage stop. هنا عندي importance of changing the biological half-life because both the drugs اللي هم الاتريتينيت والacitretin are teratogenic. So it's important for example a female patient who would like to become pregnant and she suffer from psoriasis. So in this case it is recommended to take a shorter half-life drug which is acitretin that will be cleared from her body within a reasonable period of time. فهنا استفادنا من البرودرج approach، حولنا الاستريتين إلى برودرج approach. البرودرج اللي هو الأثل إستر to increase the half-life إذا نريد نطول مدة العلاج. Protein binding. once the drug enters the systemic circulation, it can remain in solution form, or it can bind to proteins, serum proteins, especially albumin. So many drugs will bind to serum albumin to form a drug albumin complex, and this is a reversible process. This protein binding can affect the effective solubility of the drug, can affect the biodistribution, can affect the half-life, and can affect interaction with other drugs. So drug albumin complex can act as a reservoir whereby enough concentration of the free drug can be released, and this will give a special response. Also, the drug albumin complex can limit the access to certain body compartments. And the example here is the placenta. Placenta will block the passage of proteins from the maternal blood circulation to the fetus. Also, drug albumin complex can prolong duration of action of drugs, and this is because the drug protein complex is too large to pass through the renal glomerular membranes, and therefore will prevent rapid excretion. Drug albumin complex can also limit the amount of drug available for biodistribution and interaction with the receptor, and the example is suramine, which is trypanoside. This remains in the body in the protein-bound form for a long time. The half-life of this drug is of this compound is 50 days, and therefore it remains in the protein-bound form for several months in the body. The drug protein binding also can affect the drug-drug interactions, and the example here is warfarin. And these drug-drug interactions will result from the ability of certain drugs to displace other drugs from the binding site on albumin. Example is the anticoagulant warfarin. Warfarin usually is bound to the albumin and remains in the body in the form of albumin, drug albumin complex. And however, the taking other drugs that can displace warfarin might be dangerous, because this will release the warfarin from its binding site from the albumin complex, and therefore the effective concentration of warfarin will increase, and leading to increased prothrombin time, and this might lead to potential hemorrhage. Tissue depots. The drug can also be stored in tissue depots, and the important reservoir or depot is the neutral fat that constitute 20 to 50% of body weight. The example for a drug that can be stored in tissue depots in the neutral fat is thiopental. Thiopental is general anesthetic. It's one of the barbiturates, an ultra short acting barbiturate. This means the drug, because of its high lipophilicity, it will enter the blood-brain barrier to the brain and give its effect visual anesthesia. However, because of its high lipophilicity, it will redistribute again outside the brain and stored in the storage depots, here neutral fats. And by this, the effective concentration is only when the drug first enters the blood-brain barrier and enters the brain and gives its will be present in high concentration to produce pharmacological effect اللي هو anesthesia. However, when redistributes again outside the brain and stored in the neutral fat, then it will diffuse slowly out of the tissue depots. However, this diffusion the drug will be present in low concentration that will not produce pharmacological response. Drug metabolism. هنا عندي changes that can take place on drugs in the liver. وهذا عندي chapter كامل اللي هو chapter اللي بعد هذا اللي راح ناخذه for drug metabolism. After or following the administration of drugs, the drugs can be present in the circulatory system and then can go to the liver, or after absorption, when drug is taken orally, also the drug can be absorbed from GIT, enters the portal vein, and then transported to the liver. Here in the liver, the drug will be metabolized by hepatic enzymes present in the liver, mainly to an inactive compound, and this is happen during during the initial trip through the liver, which is called first pass effect, whereby most of drugs were converted after this first pass effect into inactive form. A classical example is of the significance of first pass effect is lidocaine. Lidocaine, local anesthetic, and also used as antiarrhythmic agent. This lidocaine cannot be given orally because it will be inactivated in the liver through first pass effect to inactive product, and therefore cannot be given orally. When it is intended to be used as antiarrhythmic agent, it should be administered intravenously. However, this drug have a short half-life, which is about 2 hours. Structural modification can be made on this drug to increase its half-life, and the analog is tocanide. Tocanide is analog of lidocaine. الستركتشر هنا مطلوبة. هنا حولنا الليدوكاين إلى توكنايد اللي هو أمين برايمري أمين أنالوج. شوف التشينجز اللي صارت على الستركتشر، حولناه إلى برايمري أمين أنالوج. هنا in contrast to the lidocaine اللي عنده short half life only 2 hours, توكنايد هنا can have a longer half life. Half life مالته converted to 15 hours. Sometimes in drug metabolism we have inactive drug and converted through metabolism to active metabolites, or sometimes the parent drug and its metabolites are active. Drug excretion. The main route of excretion of a drug is through the kidney. We have another route is through the feces, where drug can enter enterohepatic circulation. So through the after absorption, drug will enter portal vein and then goes to the liver, and from the liver it can excreted again through the bile by the bile duct into the intestinal tract, and then will be excreted in the feces. Another route of excretion is the human milk. And here we have the nursing mothers. The metabolites or drugs can be excreted in the human milk of nursing mothers. The receptor. The receptor is a small region of macromolecule. It could be an isolable enzyme or a structure component of cell membrane, or a specific intracellular substance as a protein or nucleic acid. The drug usually binds to the receptor, and this will form an equilibrium of a drug-receptor complex. This will result in pharmacological response. Several factors contribute to drug binding to the receptor. These factors include structural classes. So for each class of compounds, there are specific type of receptors that these compounds will bind. For example, benzodiazepines will bind or combine with GABA receptors. Also, another factor affecting drug binding to the receptor is the three-dimensional shape of the drug, as well as the types of chemical bonding. The initial receptor model is considered to be a rigid lock and key concept. However, the newer aspect of the receptor is a flexible model whereby molecular graphics using computer programs you can calculate the preferred conformations of both the drug and the receptor. So the receptor and the drug both can undergo a three-dimensional adjustment. So you have the receptor can undergo three-dimensional adjustment upon binding of the drug to the receptor, and this process is called docking. So docking is placing the drug into the receptor and predicting the preferred orientation of the drug when bind to the receptor. Methods of isolation of the receptor is we have the affinity chromatography and we have the recombinant DNA. Recombinant DNA is the DNA formed by laboratory methods of genetic recombination, such as molecular cloning. Receptors are not distributed equally throughout the body. So depending on the organ in which the receptor is located, the same receptor class may behave differently. This can be advantageous, whereby focusing a drug on a specific organ. However, this can cause also adverse or side effects because the drug can exert two different responses based on the location of the receptor. For example, selective estrogen receptor modulators, SERM, and the most common example is tamoxifen. Tamoxifen is used for estrogen-sensitive breast cancer, and also it can be used for the treatment of osteoporosis, for reducing bone loss. However, prolonged treatment or use of tamoxifen can increase the risk of endometrial cancer. This is because tamoxifen can act as estrogen antagonist in breast, and at the same time it will behave as agonist in bone and uterus, and therefore selective estrogen receptor modulators cannot be classified simply as agonist or antagonist. Rather, they can be considered as variable agonist and antagonist. However, Another selective estrogen receptor modulator is raloxifene. Raloxifene can act as antagonist in the breast and therefore used for estrogen-sensitive breast cancer, and agonist in bone for osteoporosis, and therefore it has lower or fewer side effects and lower risk of uterine cancer. So the goal is to design drugs that interact with the receptor at specific tissues. And this can be done either by altering the molecule, changing biodistribution, searching for structures with specificity for target receptor, decreasing therefore the adverse effects, or you can attach the drug to monoclonal antibody, and this can bind to a specific tissue antigen. The biodistribution can be altered by several ways, either by changing drug solubility or enhancing ability to resist metabolism, or altering formulation or physical properties of drug, or changing the route of administration.